Hello, welcome everybody. Hi, my name is Jada. I'm founder of Boober and here today with Shawna King, who is a wonderful midwife. We're going to be speaking with. I'm going to tell you more in a moment, but as you are coming in, we just want to welcome you. And if you feel like it, drop into the chat where you live, how pregnant you are. Tell us where are you giving birth in home, hospital, birth center? We're talking to everybody here today. So it's kind of nice if you drop into the chat, then I know somebody can hear us. So that would be good and helpful. We could see where you are out there. So my name is Jada Shapiro, founder of Boober. Boober is a platform where expectant parents and new families can find all of their pregnancy to postpartum care providers, such as birth doulas, postpartum doulas, lactation consultants, and mental health therapists. We were all in person before the pandemic. We rapidly converted to virtual care so we can support you wherever you are coming in from today virtually, or if you're in the New York City area, we are back to there are people doing in-person care again, and certainly in other places as well. I'm also the founder of Birthday Presents, which provides childbirth education classes, and we have been teaching since 2002 childbirth classes, breastfeeding, newborn care, infant CPR and safety, and we run many doula trainings per year and lactation counselor trainings. So that is a little bit about me, and I'm going to now introduce Shawna King, who is the founder of MI Midwifery, which provides prenatal, home birth, postpartum, and integrative gynecological services with a holistic and individualized approach, allowing their patients to make informed decisions about their body and their birthing experience. And since graduating from State University of New York at Downstate in 2002, Shawna has had the privilege of caring for families from all boroughs and in a variety of settings, including hospitals, in-hospital birthing centers, freestanding birthing centers, and most recently home births. So Shawna has delivered babies in every kind of possible place where you can have a baby, which is really exciting to have her here and all of her knowledge. She has dedicated her practice to providing evidence-based care in a personalized and meaningful way while striving to form a partnership that empowers people to make informed choices about their bodies and their health. And Shawna believes that when a relationship of trust and respect is created through intimate collaboration, the best outcomes can be achieved. She considers birth to be a sacred life event and loves to be part of the journey. So I'm really excited to have you here. Pulled together some parts of your bio, but we'd love to hear from you, Shawna, if you could just tell us a little bit about your career and your experience as a midwife, because I know you bring so much to the conversation here today.
Yeah, so I mean, that really sums it up so much, but for sure, it's just been such a pleasure to be with families and birthing people in all of the different settings that I've been able to do that. Most of the career has been in hospital, and you know, it was been very interesting to see what happened from the early 2000s and how things have changed now in 2020. And I made the transition to home birth about a year ago. And so this has also been a really interesting time to be out of hospital, because that also coincided pretty, you know, COVID happened pretty quickly after I made that transition. And so, you know, my experience in home birth, it's, so much of it has been centered around some of those COVID precautions and how people have made that transition to home birth when there were those really strict protocols around COVID. So it's just been really interesting to be a part of that experience and just this current pandemic and how things are happening. So I think I have sort of a unique experience with that.
I'm so excited to talk to you more about that. Thank you. And I just wanted to thank Hatch tonight, who is sponsoring this talk. And I also know that several of you who are signed up expected as well. We were supposed to have Dr. Julie Capiola with us, who unfortunately could not be. And so we are going to get you some information. We've done several webinars with her, so we'll be sure in our follow-up email to get you a link to one of the recent talks we did so that you can get all of the pediatric information that you may have been expecting as well, although we can also speak to many of those questions you might have. So I just want to invite everybody who is here, who's come in, if you want to drop into the chat where you live, and welcome Chelsea in LA, and you're thinking about hospital versus birth center almost at the end of first trimester, so we can answer some of those questions as well. And anybody else out there who wants to drop into the chat where they live and how pregnant they are, that would be lovely for us just to get a sense of who's out there. There's also a Q&A down at the bottom of your Zoom where you can drop into the chat if you have any specific questions that I can, and this is really an opportunity. I'm going to ask some questions that came in advance, ask some questions to Shawna about pregnancy, birth, postpartum, lactation during COVID, but also this is an opportunity for you guys listening or watching to be able to ask whatever questions you have of a very experienced midwife. And I myself am also a longtime doula and childbirth educator and lactation counselor as well. So we got you covered on all of the questions that you might have. So welcome Larissa and Valerie in LA also, 29 weeks. And we have somebody who's 36 weeks, Florida, 34 weeks, wonderful. I'm from LA as well. Hi to LA people, live in New York though. We have somebody 18 weeks in New York City, Upper West Side. Welcome. Welcome everybody. It's so nice to see you all, or see you all as little chats. Oh, hi, Ty from Silver Spring. Officially 20 weeks. Wonderful. All right. So Shawna, if we could just start talking a little bit generally. We have Nikki who has a 3-week-old in New Jersey. We could start talking generally about, we understand that pregnant people may be more likely to have a more severe illness if they were to contract COVID-19. Can you speak a little bit to this about what the risks are, if we're pregnant, are we more susceptible? What's going on with that?
COVID, because it's such a new virus, we don't know a lot about it, and we definitely don't know a lot about it in pregnancy. And it's just since the beginning of the year, we have been getting little pieces of information, and as unfortunately, as more people get infected, then we get more information about how this looks in pregnancy. People who are pregnant are not more susceptible to getting COVID. Really, your risk to getting COVID is the same, whether you're pregnant or non-pregnant, but the severity of the disease can be increased. And that's really the same with any viral illness, also like the flu. With those symptoms, anything that has a respiratory component to it, the symptoms can be more severe. And a pregnant person who gets COVID has an increased risk. They're more likely to need an ICU admission than someone that's non-pregnant when the disease is severe. So, we are in the middle of a pandemic, and so it's still something that we have to be, looking into what those precautions are, and especially when pregnant, being really vigilant about the masks and the social distancing and all of those things, because it can be more severe, and the risk when the disease becomes more severe than the need for ICU admission.
Yeah. So if you have pregnant people, or your clients who are in certain frontline jobs, healthcare workers, essential workers, are people asking you, or are they talking about, I know I've read, this idea that if you are later in your pregnancy, potentially getting some type of transfer or shift if possible, when possible,
Yeah, this is something that is really important to talk about. I think just what so many people have already been given the option to work either, remotely or some kind of schedule that allows them to be social distanced and, travel in certain ways. But for sure, if someone's really finding themselves in a situation where they're not able to really safely work in whatever environment is, teachers, nurses, these frontline workers, then we have that conversation. And, if I need to write the note to say, that I feel like the risk is too high for this person, then that's something that we do. But it really has to be individualized. I wouldn't say that, every single teacher should stay home. I think that it really just depends on what that risk looks like, what the population looks like, where are we talking about? Is this in a place where the cases are going up? So those are really, for New York City, some of the teachers had the option for going remote that were pregnant, teaching remotely, teaching virtually. And so, I found myself writing some notes for those people. And I think that it just has to be individualized, really.
Can you speak, as we're talking about protecting ourselves, right, and really using masks and social distancing? A lot of people have asked questions about the flu shot as we're in this season and moving into flu season. Could you speak a little bit to your thoughts on flu shot at this time when pregnant and with COVID?
Yeah. So flu shot every year is recommended in pregnancy, and it's recommended during the flu season. It can be given during any trimester, so even in the first trimester and as late as the third trimester. There have been so many studies done on the safety of the flu vaccine. If I have, a patient that's concerned about the flu vaccine or concerned about preservatives that are in vaccinations during pregnancy, there are preservative-free flu vaccines that are available. So I usually just tell them to ask their local pharmacy if they can get the thimerosal-free vaccination, if that's really what's holding them up from getting the flu vaccine. But it is recommended by all of the professional organizations, ACOG, the ACNM, everyone recommends that pregnant women get the flu vaccine. And I think that this year, because flu symptoms can mimic COVID symptoms, I feel like this year it's even more important for everyone to get the flu vaccine to minimize, the need, urgent care visits, hospitalizations, and just putting any more stress on the healthcare system than what's already there with COVID.
Yeah, definitely. That makes a lot of sense. And actually, we have a question that just came in related. Curious as to the thoughts around asking those who will be around the baby to get the flu shot. Are there any other vaccines that baby caretakers should get? So if you could speak to, yes, the visitors, the family members who might be coming over, although that's something we're also going to talk about because that's a big question during COVID, who is coming over after and at what point as well. A lot of people have questions about that. But could you speak about, should we be asking our family members to have flu shot and what other vaccines you would recommend?
The two vaccinations that are recommended for anyone who's going to be a care provider for the baby, flu vaccine, number one, during flu season, and number two is the Tdap vaccine. So this vaccination, the most important component of it is the vaccination against pertussis, which is whooping cough. And this is also actually another respiratory illness. This virus is especially dangerous for newborns who their lungs are still developing, and the lungs are the last thing to mature. And so when they get a respiratory illness, they can become quite ill, and in extreme cases, need to be hospitalized and can even die. So there has been a very big push to have anyone who is going to be a care provider for the baby, especially in the first 2 months, because the baby's not going to be able to get their vaccination until they're 2 months old. So that first 2 months, so if the grandparents are coming, the aunts and the uncles are coming, you have the best friend, whoever that is, I think that it's totally an acceptable thing to just say to them that these are the 2 vaccinations that we would like for you to have so that you can help to keep our family, safe and healthy. And I think anyone who, respects you and cares about your health and your baby's health will totally understand. Or, then you have to have those tough conversations. But I think that I've found that, it's something that has to be brought up. And if you bring it up early enough to give everybody time, what's really nice is so many pharmacists now will give vaccinations. So people are not having to go to their primary care doctors, but can actually just go to their local pharmacies to get the Tdap and the flu vaccine. And they take insurance. And so that can also just help. It just makes it a little bit easier for people to access those vaccinations.
Yeah, definitely. can you talk to us a little bit about telehealth visits? I wanted to speak, as we're talking about social distancing, how many, of course, over the pandemic, many visits have shifted into a telehealth version. And I was wondering if you could speak a little bit about how the pregnant people here can make the most out of their telehealth visits, and which visits do you consider still to be very important to do in person? I know we're in the New York City area where things are much better. So you may have shifted. I'm not sure what your protocols are. I'd love to hear them. But as we have people listening from all over, I would love to hear your thoughts on maximizing the telehealth visit and which ones still are really critical. And even if I had a telehealth visit suggested or scheduled, of course, if something were to come up with me physically, there might be a reason for me to still be seen in person, right? So I'd love for you to address that.
Yeah. So I think you can still accomplish so much in a telehealth visit. And when we started to establish our protocols around how our telehealth visits were going to look, one of the things that I thought just how we approached the telehealth with our clients, and that this in a way was allowing the people that were in our practice to even become even more engaged in the care, because they're taking some level of responsibility, because we're not seeing each other in person as often. So I'm really expecting, when we're not in person, that you're really relaying what's happening for you when we're not together. We're having everyone get blood pressure cuffs so that on those visits that we're not seeing each other in person, you're able to take your own blood pressure, because that's one of those major, one of those things that we're monitoring during the pregnancy, and we want to just make sure that we're staying on top of that. I have not done this in my practice, but I do know some midwives who have actually had their clients get their own fetal Doppler so that you can listen to the baby's heart rate. And so on those visits where you're not seeing each other in person, you're actually, locating where your own baby's heart rate is and then listening to it. And then the midwife is hearing that. And
I was going to ask you, actually, could you clarify on that a little bit? It's interesting that you're not doing that. And I know some people are and some people are not, but I know that there is a question about, should we only do it when we're told to do it? Is there a risk to over monitoring yourself, or what are the side effects that can happen when you just have your own monitor at home? Because I think,
Yeah, I think that if you're doing it, I think that it can cause some anxiety, and especially if you don't know exactly how to do it, if you haven't been guided, if it's not a part of the practice that you're in. I think that you just have a discussion with your provider and just say, hey, you haven't told us to get a Doppler, but we're really interested in getting one because we're not going to be seeing you as often in person. And I can't imagine that someone would tell you no, not to do it. But I think that even me, I've been practicing for 18 years, and there's times, depending on what the gestational age is, it's difficult to find where the heartbeat is. And so that can be anxiety producing if you're trying to listen and you can't hear it. And then of course, you're thinking all worst case scenarios. So I think that it's best to do it, when you have someone who's helping, showing you where to locate it and just guiding you through that. Because you don't want to make it something else to be anxious about. There's already things to be worried about. You don't want to be worried about that. And so I would say that there has been a schedule that has a reduced number of prenatal visits. I don't think that everyone's doing this schedule. I think in New York, some people have added in more in-person visits, but when we were in the height of COVID, we were doing in-person, those essential visits where we either are needing to do blood work, we're needing to do cultures, or this is a check-in for evaluating size of baby. So the first trimester would be at 12 weeks, and then there was a 20-week visit, and 20 weeks is also usually when the anatomy ultrasound is done. So for offices, not midwives don't do those ultrasounds, but there are some offices where they do those ultrasounds in the office, and so that might be when you do that 20-week visit. And then there's a 28-week visit, which is where you do the diabetes test, screening for diabetes in pregnancy, and then the 36-week visit where the group beta strep swab is being done. So those are really the 4 major visits, that there's something really essential that's happening where the provider needs to see you face to face and needs to be in person. And then really every other visit could essentially be a televisit, and that and I think that that's really up to practice and provider preference and patient load and all of that. I do a few more in-person visits. I have a smaller practice, and so it's a little bit different, and so I do a few more in person, but in the height of COVID, I was really limiting it to those essential visits.
Great. And were there any other things that somebody would need at home for the visit? So we said blood pressure cuff, possible being able to listen to the Doppler. Thank you. I'm like, where'd the word go? Possible Doppler. Thank you. Anything else on the prenatal side?
What
about weight? Do they need a scale?
Yeah, you could have a scale. Yes, a scale. And there may be some practices who might be doing some urine, but I haven't really heard that, but that is one of the things that we typically do at in-person visits. But that really just depends on the provider, whether or not they're having you do urine. But usually it's weight, blood pressure, and maybe the fetal Doppler.
Yeah. And then for after, I know, just to add this in, since I know some people have baby here, that, the same thing could go with scale. If you just need a generalized scale reading that the baby's gaining some weight, of course, you can hold your baby on your scale and then have somebody else hold the baby or put the baby down and get a generalized. This is not a very accurate, this would not be a great way to find out if the baby is gaining by the half ounce. But people have also been using, I know through the pandemic, a lot of lactation consultants at Boober certainly have had people using pastry scales to weigh their baby, as long as the baby could safely be, placed in it. And that some pediatric visits, say that it can be great to have a scale, because if you are concerned, and you can check, and you don't have to keep running in to get a weight check. But I think the same warning certainly has been given by many pediatricians, which is not to overweigh the baby, constantly looking for this, that ideally we're weighing the baby in guidance, either with the lactation consultant or with your pediatrician when they need a reading. And then maybe, you could do it once a week or every 2 weeks or something to get a general pattern, but that sometimes we can just start to over monitor a little bit, and that can make us also a little more anxious than we need to be. So just putting that out there.
I think that really, the take-home message with any of these tools is that it's best to have some guidance from your provider. What are the expectations? What's the parameter of normal? What are you looking at? Because you can just be lost sort of in the abyss of oh, should I be worried about this or not worried about it? And I think you really, it's nice to have the guidance of your provider and someone who can really let you know what you're looking for when you're doing these things, even with the blood pressure,
Right. Totally. Absolutely. So let's talk a little bit about, it's time to deliver. You're getting ready to have your baby, or you're going into labor. And I know we have, somebody here who hasn't decided where they're giving birth, and other people birthing in different environments. I just want to talk a little bit about expectations in terms of people wearing masks. What are you hearing in terms of people? Are you having that necessarily in your practice right now? Or also, let's just talk about what we're hearing in general throughout the hospital system.
Yeah, I would say that, definitely home birth is its own, unique situation, the relationship between the client and the home birth midwife, and what we decide to do as far as our PPE and precautions. My assistant and all the doulas and myself, we when we come to a birth, we come in our N95s. We're still wearing full protective equipment. We have not really changed any of our protocols as far as the PPE since when COVID started. We really, we sort of set in place what felt comfortable for us. We haven't required that asymptomatic, if I have someone who's asymptomatic, we have not required that they wear masks, but we have limited the people that have been at the birth, where, home birth, I think, and even including in birth center birth, that, one of the perks of that is that you can have lots of people around, and there aren't really any protocols around, the number of guests the same way in a hospital. But when COVID started, we really had to limit, for ourselves and for, the person giving birth and for the newborn, limit the number of people that were around. And so it's really to this really tight team of people, and us all understanding, our exposures and our risks. And in the hospitals in New York, what I know, and, unfortunately, each hospital has its own kind of protocol. That's just how our healthcare system works. There's not a universal, universal protocol for all hospitals. But what has been happening at most of the hospitals is that when the birthing person presents to triage to be evaluated for labor and whether they're going to be admitted, that the triage, they're there alone. And they're not allowed to have a support person in triage. And so they're there by themselves, wearing a mask. And my experience in 3 different hospitals, sorry, let me just close my door quickly.
No worries.
Sorry. My house is getting noisy. I'm sorry, everyone. My experience in 3 different hospitals is that in the New York City area, recently, within the last couple of weeks, is that in one of the hospitals, the mom was, they were all tested for COVID, but the tests are not coming back, sometimes as quickly as the person is giving birth. And so you're required to wear the mask until you get the negative test. But if you present to the hospital and then give birth pretty soon afterwards, you'll be wearing a mask throughout your entire labor and birth. And so I had that scenario for one client, and then I had another client who went in and gave birth after the negative test came back. And once the negative test came back, she was allowed to take her mask off, but of course everybody else in the room had to keep their masks on. Midwives have always promoted, well, I'd say always, but, we really promote early discharge in, in a low risk situation, when breastfeeding's going well, and, when mom and baby can get home and start to settle in, into their, home environment and their routines there. And so, and that was something we've battled for years. But the one nice thing about COVID is people don't want to keep you in the hospital any longer than they need to. So they're actually early discharging a lot of people, which I think is really nice. So that's one of those benefits of what's one of the COVID protocols. So if you've tested negative and, you've had an uncomplicated hospital stay, and, and you and baby are both doing well, most of the hospitals in New York City are discharging at 24 hours, 24 to 36 hours.
Yeah, it's been really interesting to see that shift and see how many people are leaving at 24 hours now. And after cesarean birth, which used to be, 4 days, we're seeing a lot of people at 3 days.
Yep.
And I think for all of the people watching, what we always like to talk about in terms of these protocols, because some of you are not due for quite some time, and we know that things change daily, weekly in terms of COVID protocols. So, you know, it can be helpful for you to check in. You can check in now with your care provider about what the protocols are, but it can also, you don't necessarily need to find out what all the protocols are right now, you know?
Yeah.
That's what I kind of say, like that one is changing so frequently. Let's wait and see. It depends what's happening in your area.
Yeah, it's really been a sort of a day by day. That's how I've counseled people in my practice, just that I can tell you what's happening today or what happened when I, you know, last, you know, was in the hospital or had someone in the hospital a week ago, but I don't know what's going to be happening in a week. And so we just have all had to be really open and sort of flexible around these protocols. What has been really nice though is that I think that overwhelmingly everyone realizes that birthing people need support, that they can't, you know, be in a hospital alone and be expected, you know, to give birth by themselves, and that's just not acceptable. And so I think I'm really hoping that having your partner and labor support person, that these protocols will not change. You know, I'm hoping that that's going to stick.
Yeah.
You know,
hoping that as well. And I know it depends where you all are. Certainly New York went through a phase where we had, 5 days where you could not have your partner or a doula. So, you know, no partner at all. And then that was revoked, and then partners came back in, but still no doula. But now doulas are back in. We've been back in the hospital for quite some time now. So, you know, there are doulas. Actually, I'd love to, let's talk about doulas, since you come from your caregiver perspective. Obviously, I've been a doula for a long time. I think that's how we met, actually, through me being a doula and you being a midwife. So, you know, for the people out there who are thinking about working with a doula, depending on what region you are in, there is certainly virtual birth doula care if you are unable to work with somebody in person or uncomfortable with that. And then in many places in person and using PPE, and depending, and you'd want to talk to each individual doula how they're practicing, who they're seeing and what they're doing. But I would love to hear from you, Shawna, if you could talk about your experience of working with doulas and why you might like to have a doula at your birth. If you think that, I mean, you as a caregiver, why it's helpful, from your perspective.
I mean, from the beginning, I've always, you know, it's been one of the big things that when, you know, people come to me during the pregnancy. I've worked in some really big practices, big, you know, medical hospitals that have high induction rates, high C-section rates. And, you know, I've had, you know, when people are coming for midwifery care, you know, they're asking, how do I, you know, reduce my risk for X, Y, or Z? How do I, you know, have an unmedicated birth or physiologic birth? And, you know, choosing your provider is really important, and having these discussions with the provider, I think is so important to that. And then I think also equally important is who you're having there to support you, and having someone who is there as a professional person who understands birth deeply, who respects the process of birth, understands, you know, hospital protocols and politics, and also just, you know, who's there to focus on you and your support and advocating for you, I think is really one of the best investments you can make. Yeah, I just think that it's really, it's just so important. I think partners can do a lot of that, but I think it's a lot to ask a partner, because they're also very emotionally involved. They're seeing, you know, this person that they really care for and love, you know, going through this really challenging moment. And I think that it's nice to have, you know, the doula there for the whole, you know, for everyone, for the partner and for the laboring person, because there's a lot of support that's needed. And, you know, I've had clients who, you know, have not had doulas, and then who would have really benefited from it, and or have had situations where they didn't have a doula maybe the first time, and then I'm like, okay, the second time, let's do it. And then they've really noticed that there was such a big difference in their experience. So, you know, as a provider, I'm like, hey, first thing, get your doula. You know, you've got your midwife, now get your doula. Like this is, you've got to assemble your team. You want to make sure that everybody in the room is rooting for you and they're focusing on your support, whatever that's going to look like, whatever you're choosing for yourself. You know, supporting your decisions. Not everybody wants the same thing. If you want the unmedicated birth, then great, get a doula. You want an epidural, great, get a doula. It's not, you don't have to just be somebody who wants to, you know, try to go without an epidural. I think if scheduling a C-section, get a doula, like whatever it is. Like there's just so much benefit to having, you know, somebody on your side advocating you that understands all of it, the physiologic process, the emotional process, the hospital process, all of that. We all could use an advocate in those situations. You know, I need a doula.
100%, like in life. I mean, every time I go to the dentist, I tell my dentist, I'm like, you know, I'm a doula. We should really have dental doulas here. Is that a thing?
Yeah, please.
You know, so I think, yeah, I mean, well put. Like we all need and deserve support, no matter what we are planning for our births. And we all know that whatever we're planning or thinking, it's not always how it goes. Things often go differently, just even how we feel or emotionally or how we're responding to the experience. And I think that doula support can be incredibly valuable. And doulas also do a lot of prenatal preparation. They do a lot of emotional and informational support ahead of time. And even virtually, it's been really interesting. You know, you could virtually work with a doula in the screen where we'd actually be showing comfort techniques and measures and sending pictures and things like that. But a lot of times people we're whispering in your ear and earbuds too, and just providing emotional support when that's the only way, you know, to support. Oh, I see somebody going, yes, with exclamation points to life doulas. Yeah, so definitely think about it for sure. And, you know, you can always talk to doulas to see if it feels like a good fit. And I'm going to give you some codes through Boober. Certainly we give everybody a little discount code here. And also I just wanted to say, those of you who have your phones with you, if you are on Instagram at all, please follow us at Get Boober. We do lots of different teaching. We talk about doula care or midwives. We introduce you to all sorts of lactation tips and things like that. Do you have an handle at all that you would like us to share while I'm dropping that at the moment?
And it's okay. I actually don't for the business yet.
Okay, cool. Well, you guys can, well, still put, you'll be able to find Shawna if you need her support at all, and we'll share that.
You can just put my website.
I will drop that in a little bit. So, you know, if you do want to work with a doula, you can also talk to your care provider about that and how, you know, they sometimes have particular doulas they work with and or not, and you get you can talk to them about that. So let's talk a little bit, continuing on protocols. Would love to talk about skin to skin contact right after the birth. And a lot of people do have the question or concern, and certainly earlier, I think in the pandemic, there was a lot of questions right in the beginning of, should we put the baby in skin to skin contact? Are there any issues around that? And it seems in my experience now that most people are saying like skin to skin contact, even if, you know, is okay. Breastfeeding is okay if you're COVID positive, in fact, encouraged, but that there are safe ways to breastfeed and be in close contact if a parent is COVID positive. So I'd love to hear your take on skin to skin contact right after the birth with the baby, if everybody's fine.
Yeah, as long, you know, most of what is out there, you know, as far as research and transmission, you know, the baby would obviously be at increased risk of getting COVID, you know, if the mom is positive. And so I think there has to be a real conversation between, you know, the family and the providers and pediatricians about what that's going to look like. And hopefully you have this information in enough time to, you know, to sort of figure out how this is going to look. And a lot of it depends on severity of disease. If mom is doing well, then, you know, using those same precautions, you know, pretty much we're just always you're not social distancing, but you're washing your hands, you're wearing a face mask, you're just trying to avoid exposing the baby to any of those droplets if you can. The studies that have been done on the breast milk, there is no transmission of COVID through the breast milk. So babies, if it's safe to do so, babies should definitely be, allowed to breastfeed, and moms should be, people should be encouraged to breast or chest feed. And yeah, I think that we just have to be, just mindful, and that each situation is going to be very individualized, and that they're really going to be looking at the severity of the disease. But I think, there have just been so many studies done about how important it is, the skin to skin, and obviously breastfeeding. And so we don't want to deny a mom who's otherwise healthy and a baby that's healthy those opportunities if it can be safely done.
Yeah. Thank you. And in general, in terms of, let's talk a little about baby, and then we'll kind of go back out. In general, people coming to visit, grandparents, postpartum. Let's talk kind of all about that postpartum recovery phase. We talked about how in many hospitals after vaginal birth now we're looking at a 24-hour release. Sometimes I am seeing a few places now getting a little bit longer, like you said, at least in the New York City area. But I think anywhere that has a higher risk rate of COVID positivity, they are probably pushing you out, and you're gonna be going home. So let's talk a little bit about just preparing for postpartum. What kind of support, healing. Let's go healing first. Let's talk about how you would talk to your patients about preparing for postpartum recovery in general.
So I like for people to be really prepared before we get to postpartum. We're talking a lot about what it's going to look like, as far as how are you feeding yourself? We talk about preparing freezer meals, having stuff easy and already prepared and frozen in the freezer, so that when you get home, your partner or whoever's coming to support you postpartum can just throw that either in the microwave or on the stove and have a quick meal. Because also, your partner and yourself are both going to be pretty sleep deprived. And so everybody needs to get their rest and not spending a lot of time preparing food. So for those first, couple of weeks, I like to have, people already have some things in the freezer. For those of us who live in New York City, LA, we have Seamless, we have so many delivery options. Not everybody has that, easy, get food delivered, right to your door. But I think it's also still nice to have some homemade meals, hearty homemade meals in the freezer. I really like this book that's called The First 40 Days.
Yeah.
It's a beautiful book with some really beautiful recipes and suggestions. And I think that it's interesting to consider that there are some cultures where women spend 40 days being taken care of in bed, food being brought to them, and that for those 40 days, they're bonding with their baby, they're healing, they're resting. I know none of my clients are going to stay in bed for 40 days. If I get 4 days, I'm lucky. So I like to break it down into 5. So it's like 5 days in bed, 5 days next to the bed, and then, 5 days you're around the bed, I guess. And not everybody can do that, and especially if little ones at home, you're ready to get, back to taking care of them. But I think to just consider that it's really important to give yourself the time to rest and heal, and you won't get this time back. Once you leave this postpartum phase, that nice little space where people are taking care of you and you have the baby and you're doing that, you know, once you're back to normal life and you're cooking and you're cleaning and doing the laundry, then that's sort of, now you're doing that. And so I just try to encourage people to stay in bed if possible, as long as possible, you know, let yourself heal. And it really depends on also what kind of birth you had. Every birth is a little bit different, but I still think even with my super low risk vaginal deliveries, you know, spend that time. It really helps with the breastfeeding, it helps with the bonding, it helps with the milk supply, you know, really honoring that time. And, you know, everybody has their own family situation, so it might look different. Maybe you can't totally be in the bed because you have other responsibilities for other kids. You know, anyone who's a single parent and has other kids at home, you know, whatever that might look like. But taking time throughout, you know, at some point in the day, if the baby's sleeping, don't worry about folding the laundry right then. Maybe you also lay down and try to take a little nap while the baby's sleeping during the day, you know, and just realizing all those chores will eventually get done. They don't have to get done right now. And so that's we talk a lot about that prenatally. And I think that's one of the really important things about prenatal care is this preparation. You're preparing for the labor, the birth, and the postpartum so that we don't have too many surprises when we get to those events.
Totally. Yeah. No, I mean, I really like also, I talk about kind of like figuring out what are your circles of support for after, like, you know, what are the friends or the family on the outer rings? Who are the, even in COVID, who are we calling? Who are we FaceTiming with that can make us, who isn't so judgmental and can answer those questions and really hear us if we need to cry or laugh, right? And then also postpartum doula care, of course, we always talk about too, grandparents. But can you speak a little bit in terms of, you know, with grandparents coming, what precautions should be taken in terms of, you know, them visiting us? What are we looking at from your perspective?
And this is also totally individualized for each family because everyone has their own situation. The one thing that I do say, just talking, because you were talking a little bit about your circles of support, because I always just say to my families that when people are coming, they're not coming to visit, they're coming to help. Like you're coming, you're bringing food, you're gonna do the laundry or the dishes, and then you're gonna politely, you know, let yourself out the door. You know, like you're not coming to sit in the living room and someone serve you tea and talk to the parents. Nobody really wants that when they're just a couple days postpartum. They want you to come, bring them food, and you know, help with something, and then move along, you know, so they can get on. So, you know, that's a little bit about how that support looks. Yeah, so in COVID, we, you know, I would say initially, we, you know, in the height of COVID here in New York City, we were really talking a lot about who's coming to visit postpartum. That looked very different than it looks now. During that time, you know, depending on what exposure people had and how people were, you know, handling this sheltering in place, we were really asking that people, you know, wait to have in-person support from anyone, friends, family, any of that, just to keep the, you know, the circle really tight and to keep the exposure, you know, to minimize the exposure. It looks a little bit different now. We're still having some of those conversations, and it really has to do with, and you know, and like I said, it's all totally individualized, but it really has to do with what someone's potential exposure is. You know, are they someone who's going out to dinner with their friends, you know, and you know, maybe, you know, just like adhering to the precautions in their own way, but you have to figure out, does that feel safe for you and your family? Because, you know, you're bringing this person into your home. I have had families who have asked that anyone that comes in, you know, even the grandparents, that they wear masks. And, you know, so they're masked, they're hand washing, you know, really, adhering to those precautions. And then I think at the different comfort levels, you know, depending on if someone's traveling from another state. And so then we also have to consider the quarantine before they see the baby. So it really has to do with the family and what the exact situation is. But I think that, you know, just like we're doing, you know, Zoom here tonight and we have all these virtual platforms. Some babies get introduced to the family this way, you know, in a virtual way until, you know, the parents feel more comfortable about in-person support or in-person visits.
Yeah. Yeah. I mean, it's so individual, but also I think so much of us, when we become new parents, there is a lot of figuring out those boundaries in general of when we say no to people. And, you know, COVID or not, is
Yeah.
you all get to navigate, because all of our family and friends, they have lots of different ideas maybe about how one should feed the baby, or whether it's too cold out and it's, you know, and how a baby should be dressed, and all, you know, so many opinions. So I think this is one of those places where you do need to really check in with yourself and be like, what would I feel comfortable with? I mean, also grandparents are more at risk potentially of COVID, you know. And we are, so depending on what your exposure was when you were out giving birth and where you went after, and, you know, a lot of families are choosing to stay, to contain themselves for 2 weeks before somebody comes to visit as well. Not always, it really depends where you are. So
It's funny that you said that, because I actually had a couple of people who said to me, oh, well, this makes some of those really hard conversations about having my family come over so much easier, because I can just tell them they can't come because of COVID.
right.
So, you know, so it's actually, you can pull the COVID card, you know, it's a nice thing to do when you need boundaries and
Yeah, for
you
some
need
people,
space. Yeah. You're just like, oh, we just, you know, exposure to COVID and we think no one should come over, you know.
it does seem like COVID has created a situation in postpartum that maybe we haven't had for a long time, where people are really doing more of that nesting in and really resting and retreating in a way that we had not done before in this culture, because we used to feel like we had to bounce back and run around, and there's no running around right now.
Yep.
So that's been interesting. Somebody just wrote in any suggestions on night nurse or newborn specialist coming in during COVID. Should it be all 24 hours or just 12 hours at a time? You know, feel free to speak to that. I can also speak to that.
Yeah, well, you go ahead. What?
Yeah. Well, so, you know, at Boober, we match people to postpartum doulas who do overnight care. And of course, there are a lot of people considering baby nurses and night, you know, I mean, a 24-hour person in a way, and I don't know, you know, if you can afford that and if that feels right for your family, because you want to be living with somebody continually, in a way, presents less exposure. If they're staying with you for several weeks, then you clearly know what they're doing all the time, right? And obviously they have breaks within that time, but if they're really living with you, there are people who are asking somebody to quarantine for 2 weeks, and then they commit them to a job where they stay with them for 2 weeks, 4 weeks, a month. That was 4 weeks, or beyond, whatever it is. So that might feel more comfortable. You know, postpartum doulas also do more occasional overnights. And I find that a lot of the postpartum doulas on the Boober platform right now are taking less clients, so they know who their exposure is. They're not going to as many families as they might have in the past. So that's a question to ask and see what feels right as well with the person. So that's really, you really need to talk individually with that provider and see how they're working and how they're behaving and acting, and decide what kind of agreement you want to make with them. Some nurses are coming in and are being asked to be masked, you know, the whole time and follow precautions, but some are spending so much time with the family that it doesn't make as much sense that they to be masked, because they're in the home for so long and in tight quarters, and staying with them, and then they've gotten quarantined with the family. So it really does depend. I don't know if you have anything you want to add to that, Shawna.
I think I would say the same. I've recently had a client who had a baby nurse who came. She quarantined for 2 weeks, and then, you know, was a part of that family pod, you know, was not wearing PPE when she was with the family, but she had done her quarantine and had tested negative. And so, you know, in a way, that's really nice. They really become a part of the family, and then you've minimized that exposure. You know, that is not available for everyone based on, you know, economics and space. And so I think that it just comes down to having real conversations about potential exposures, you know, what PPE is going to be in place whenever anyone's coming into the home. You know, if you're having a doula who's staying, you know, overnight, or you have a night nurse who's just staying for the night and part of the day, you know, whatever that looks like, that you're just having those conversations. And I think that's really the most important thing, you know.
Yeah, thank you. And I am, since you're inquiring, just there's also, I just want to throw out virtual postpartum doula care, which is very different, but has been providing, and is, you know, people sort of just book an hour. It's not like the same, I can't hold your baby through the screen, but we can provide this kind of transition to parenthood support when you're really just wanting to talk to somebody who gets it and gets babies and gets what this new life is like, and you want to show somebody, like, is this diaper normal? And you can, and we can talk about it and teach baby wearing and all. So I'm just going to give you guys a code, which is 10% off if you need to use any services through Boober, or any of our childbirth classes or prenatal classes at Birthday Presents. So we have another question as we're close to the end here. I'll just ask one more question that somebody has, and then if you want to say any last words. Somebody asks, they're interested in knowing how to best help support the baby's immune system strength in terms of, you know, outdoor exposure, sanitizing after public exposure, right? Nutrition. People do ask a lot of questions like, I have my baby. Can I during COVID, can I go outside? Can I be out in the world? Can I go on walks? I think it's pretty important. So yeah. If you want to speak to that at all.
I think for the people that can and decide to do so, breastfeeding is a great way to support the baby's immune system. The baby is getting good bacteria that's lining its gut through the milk, and then also that time on the mom's skin is also helping the baby with its whole, you know, microbiome and all that good bacteria that gets transmitted through being on the skin and the nipple, and you know, just being a part of the, you know, that ecosystem there. So I think that is really, you know, if that's available for somebody, if that's something that you choose, I think breastfeeding is really a great line of defense. And so I think that's a great place to start. In the same way that we're talking about sort of creating boundaries inside your home, I think when you're outside of your home, I think that you can do that too if you have a baby in the stroller, you know, and I think that people have been better about it since COVID, but for whatever reason, people think that if there's a baby in the stroller, they can touch your baby or put their face down in the stroller to talk to the baby. And you know, it's like the babies don't have any personal space, I guess. But I think, you know, just being sort of, you know, just a little protective of that space. And even baby wearing is great, because then the baby's on your body, and, you know, someone's less likely to either touch or, you know, get in the baby space if you're wearing the baby. So if that's something that's possible, but I don't think that you have to limit sort of being outside. If you can be outside in a socially distanced way, you know, go to the park, go for a walk. I think that this is all really important for everyone's mental health. You know, once you've done your resting and your healing, and you're at that point in the postpartum where you feel comfortable getting out of the house, I think getting out is good. And, you know, this is obviously something you should, you know, you're going to talk to your pediatrician about. But I think that definitely being, you know, outside of the house is good. And I think we just have to just be continuing to consider those protocols that need to be in place: social distancing, hand washing. A baby doesn't really need any kind of sanitizing. If they haven't touched anything, you know, if this is a newborn that's obviously in the bassinet or in the crib, not in the crib, but in the stroller, then fine, they're not going to touch anything. I think if you have a toddler who's running around the playground and grabbing on things, that's a different situation. We need to be teaching, you know, the toddlers about hand washing and, you know, using hand sanitizer, sanitizing wipes on their hands. But for the babies, as long as no one's touched their hands besides you and, you know, your partner, then I don't think they need to be sanitized in any way.
Great. Thank you.
You're welcome.
Yes, it's helpful.
I'm not the pediatrician,
right.
but, you know, just.
No, and we will give you those links to the last one we did with the pediatrician, and we'll be having another one soon. But I think that was, you know, definitely exactly, I think, what we're talking about. And so we're so grateful that you could come out tonight, Shawna, and talk to all of us. Thank you to everybody who is out there listening. You can find Shawna King. I think, did I write your website right? amimidwifery.com?
Yep.
Okay.
Yep.
So you can find Shawna there. Thank you, Lindsay. And you can, again, follow us at @GetBoober for some teaching on Instagram. Visit us either way. I left you a code for all of you, which was HatchVirtual10, which works at both websites at getboober.com and birthdaypresents.com. And we're just really love to do these educational talks and hope you will join us for some future talks, and good luck to all of you as you continue to grow your babies into your little humans who are out there. Thanks again.
Thank you.
Have a great day, everyone.
Bye.
Bye. And